have been 5 million cases of COVID-19 recorded globally. We've just heard that. With reports that hormone replacement therapy, HRT, could help protect menopausal women against the disease. Well, join me now, expert Dr Louise Newson. Louise, this is quite extraordinary and very, very good news. Some indicators that women that are on HRT might have a little bit of a degree of protection.
Yeah, this is something that we're exploring. But what we do know is that men have more severe disease with COVID-19 than women, and we know that they're more likely to die, more likely to be in intensive care. So for a while we've been thinking, is there something to do with our hormones? We also know that women who are younger and women who take HRT seem to have some protection. We also know pregnancy is protective as well. And obviously in pregnancy, people have very high hormone levels. So we're working with Professor Tim Spector and his team with the Zoe app, the COVID symptoms study app. And we've added questions asking about whether a woman is on HRT or if she's having her periods or on a contraceptive pill, because we want to find the data so that we can obviously provide some evidence for policymakers. I'm also working with a team of collaborators or collaborating with a team of experts in infectious diseases, clinical pharmacology and public health in Liverpool University. So we can really explore this potential role of oestrogen in COVID-19. And we know that oestrogen is very important for our immunity. So the cells that fight any infections, and we have oestrogen receptors on these cells. So we know that stimulating them with oestrogen actually makes them work better. It makes them more efficient, so more likely to fight the disease, and also it increases the number of these cells. We've got lots of cells that are fighting infections, which are great, but if they get out of control, they can cause this thing called a cytokine storm and actually damage the tissues, especially the lungs, which is what we're seeing in COVID-19. We've also looked at some study, there's been a study in Wuhan showing that women who have low estrogen levels have more severe disease with COVID-19. So it sort of fits, but it's a theory that we're working on, but it's a very important theory because, as you know, the majority of menopausal women are still not taking HRT, despite it having more benefits than risks. So if we can show that taking HRT provides some protection, so we're less likely to get a severe form of COVID-19, then actually wouldn't that be good for people who are on the front line as nurses, people in shops, teachers, all of us that want to go back to our lives if we know we have some protection from a medicine that's actually very cheap and very effective for other reasons.
It's fascinating, as you say, early stages, lots and lots of work to be done, but still, you know, it is an interesting concept, that's for sure. One positive aspect, I guess, about this lockdown is that a lot of women are thinking about their health more. You know that we've talked about this before, that women put themselves at the bottom of the list, don't they? But perhaps now, and also asking questions. And you've been doing a lot of, it's like, I guess it's myth-busting. I know you're doing that on Instagram. You're sort of like giving proper, clear information, which is what we need.
And as you know, a lot of my work is about dispelling myths. It's about giving people evidence-based, non-biased information. I'm not paid to promote anything. I don't work with a pharmaceutical company. But what I do want to do is empower women with the right knowledge, because we know that far too many women are inappropriately given antidepressants, for example. Too many women are worrying about the potential risks of HRT, but they're not looking at the benefits because no one's told them about it. So I've been doing a series of Instagram lives very uncomfortably in my study on a Sunday afternoon to just brain dump and share my knowledge so people have more knowledge. And I think also with COVID-19, with the lockdown, we've all been looking at our health. We want to be healthier. We know that people who are obese, who have diabetes, are more likely to succumb with COVID-19. And we also know menopausal women are more likely to be obese, more likely to have heart disease. So we need to look at ways of optimizing our health. And as you know, the menopause is a long-term hormone deficiency. It's not just about symptoms. So we need to look at ways of improving our cardiovascular health, our bone health, our brain health. So hopefully some of the sort of information I've been drip feeding people, if you like, has helped. And certainly there's been an overwhelming response on my Instagram and social media, and people have found it very useful.
So what would you say are the most, if you like, the most common worries and concerns from women? Does it come down to whether or not they should take HRT or not, or what are they coming to you with?
Yeah. The main thing is the myth, the worry about HRT. Everyone worries about breast cancer and the association or perceived association with HRT. What they don't realise is there's no study that has shown there's an increased risk of death from breast cancer in women taking HRT. And a lot of the studies that are regurgitated in the press, but also are actually reported to medical press and to GPs, is based on old types of HRT that's outdated. What they don't realise is HRT's moved on, and it provides more benefits than risk. It lowers the risk of heart disease by about 50%. It reduces our risk of osteoporosis, type 2 diabetes, dementia, even death. We know women who take it for more than 18 years have a lower risk of all-cause death, including from cancer. So people have grown up being worried about HRT, but actually, as you know, it's very natural to replace the hormones that are missing in our body. We're not designed to live until we're in our 80s. In the Victorian times, we used to die in our 50s. So it's actually very unnatural for us to try and be slogging our guts out, working our bodies so hard without a hormone that responds to, we have estrogen receptors in cells all over our bodies, and that's why it's so important that we look. So definitely myths. A lot of people, I did one session on HRT and menopause for women who've had cancer. And I see a lot of women who have been diagnosed with cancer at a young age. For example, cervical cancer. They've had radiotherapy, chemotherapy, surgery. They've had an early menopause, yet no one replaces their hormones, which for me is outrageous, because young women have to have hormones to replace. So that was very popular. We also did one on vaginal dryness and urinary tract infections, and that was staggering, the response, because about 80% of women have symptoms, and it can cause symptoms such as pain sitting down, not being able to wear underclothes. You know,
no, it's things like that that we don't think about that, and we don't talk about things like that enough, and we absolutely should. I know that it's all about information, isn't it, Louise? And you've got an app coming out that's going to help women through this. Also trying to sort of like give information to GPs as well. As you say, information is power, and the more information that's out there, the better. The more understanding that's out there, the better.
And it's so right, and it has to marry. It has to be education for women. So the app Balance that we're launching next month will be really exciting, because people will be able to have a community, they'll be able to track their symptoms, and they'll be given a huge amount of information, which again is evidence-based. But also I've been working very hard with a company called 14 Fish and 3 of my colleagues, and we've developed a menopause education programme that's going to be available virtually, so online, and it will be not just for GPs, it will be for all healthcare professionals, so nurses, pharmacists, other specialty doctors as well, because we know that education is really lacking in medical schools, for postgraduates. So many of my colleagues just haven't got the confidence, they don't know. And sadly, a lot of the information that's given to doctors is incorrect, and to patients. The inserts in HRT will still talk about risk of clot, risk of heart disease, risk of cancer, and actually estrogen through the skin has no risk, and it's very, very safe. So much needs to change, but I am working hard behind the scenes with some amazing people to really make a difference. So
Louise,
women don't...
You're evangelical. Evangelical, she is.
She is. She's not a specialist for nothing, is she? No. She's doing some great work educating GPs, bringing them up to date. But it's really interesting about the COVID-19 connection with HRT. The King's College symptom study app, which I've been talking about recently, is really important in finding out whether HRT could be protective. What we know is that men are more susceptible to severe consequences of COVID, but it could be because they're more overweight, because they smoke more. There could be confounding factors that mean that it's not HRT after all. But we need to look at it, and it's very exciting because it looks as if HRT may have a protective role. But Louise and others will be finding that out in the future,
Absolutely.
won't you, Louise?
Louise, thank you for joining us. We need to get you back, because I know already, I can see we have got such a huge reaction. Obviously, I will pass them on to you, but, you know, thank you for everything that you are doing. Like I say, what we need in these times is clarity. So thank you very much indeed, and good luck with the app and everything that you're doing, and we'll talk real soon. Thank you very much indeed.